Disorders of eating habits and behaviors among school students in Ecuador. Eating disorders definition. Eating disorders are a type of serious mental health condition characterized by severe disturbances in eating behaviors and related thoughts and emotions. Unhealthy eating practices such as dieting, fasting, vomiting, and abusing laxatives are factors that can affect the development of disordered eating behaviors. Risk factors for ED, family history and genetics, anxiety disorders, life changes and transitions, trauma, extracurricular activities, body dissatisfaction, being teased or bullied, low self-esteem, advertising images of the ideal body size, adolescence and its associated physical changes.
Got 60 seconds? Take a mental health minute to learn about eating disorders. Eating disorders are serious and sometimes even fatal illnesses. Eating disorders affect all types of people. People with eating disorders may appear healthy even when they are very ill. The most common eating disorders are anorexia nervosa, bulimia nervosa, and binge eating. People with anorexia see themselves as overweight even when they are dangerously underweight. People with bulimia have recurring frequent episodes of eating unusually large amounts of food. They follow these episodes with unhealthy behaviors to compensate for the overeating. People with binge eating disorders feel a lack of control over eating large amounts of food, but don't purge, fast, or overexercise. As a result, they often are overweight or obese. The earlier treatment is started, the more effective it can be. Talk to a professional healthcare provider. Treatment is individualized, and a person may need more than one type of treatment. Learn more about eating disorders through the NIMH website and spread the word to help someone else.
Applications in nutrition. Nutritionists ask the patient about their current eating behaviors and, if necessary, provide them with a weekly meal plan and accountability to help them back on a normal eating pattern. Early detection and treatment can prevent future health problems and also reduce the risk of developing a severe eating disorder in the future. Pros. Early identification and treatment improves the speed of recovery. Once the student works through the eating disorder, they revert quickly back to their real self. After treatment, they can feel freedom, strength, energy, self-acceptance, confidence, and the love of food. Cons: It can affect physical, psychological, and social function. Low self-esteem and belief in their inability to perform. The student is listless, withdrawn, emotionally numb, unexpressive, disinterested in activities, antisocial, and incapable of concentrating. The mortality rate for people with eating disorders is the highest of all psychiatric illnesses.
Lots of people watch what they eat to keep fit and healthy, but eating disorders are driven by an intense fear of becoming overweight. They have a number of different causes, including sadness, low self-esteem, and a need for control. There's also lots of social pressure to be thin. The most common eating disorders are anorexia and bulimia. Anorexia involves eating less and less, even when you are below a healthy weight. Bulimia is binge eating and then making yourself vomit or using laxatives. Both disorders tend to start in your mid-teens. They can have physical effects such as brittle bones and liver damage. In women, periods can become irregular or stop. In men, erections may stop and testicles can shrink. Eating disorders are dangerous conditions which can lead to serious illness and even death. There's also binge eating disorder, where you diet and binge eat but without vomiting. It's not as harmful as bulimia, and sufferers are more likely to become overweight. If you think you may have an eating disorder, you need to talk to your GP as soon as you think something's wrong. It may have caused some physical problems, and some illnesses can mimic anorexia, so be sure to get a physical health check. Your GP may refer you to a specialist. Together, you'll investigate how the problem started and how to change the ways you relate to eating. They'll also help rebuild your self-esteem. When you're ready, a dietitian can talk to you about eating healthfully. There are also lots of things you can do to help yourself. Keep a diary of what you eat and how you feel to find links between the two. Try to understand the way that is best for you and why. Challenge your eating patterns and how you view your body. Talk with family and friends to help them understand how you feel. Remember, don't be too hard on yourself. Getting better is a steady process, but with a little help, you can go on to lead a happy, healthy life. To find out more about eating disorders, visit the Royal College of Psychiatrists website.
Issue apply in Ecuador. In Ecuador, the prevalence of eating disorders in adolescents is approximately 3.7%. In addition, 18.3% have a risk factor that increases the probability of suffering. The age of risk of suffering an ED in women is 15 years and in men 13 years. Conclusion: eating disorders are serious, potentially life-threatening mental and physical illnesses. However, with appropriate treatment and a high level of personal commitment, recovery from an eating disorder is achievable. The best type of treatment is one that is long-term and focused on the needs of the person with the eating disorder and their family or circle of support, with recovery as the ultimate goal.
Well, the first thing to say about the topic of eating disorders in children is that eating disorders are actually a group of diagnoses that affect adolescents, children in general, quite frequently, so that actually the average onset of an eating disorder like anorexia nervosa, for example, is around the time of puberty, or maybe 3-4 years after the onset of puberty, so in the mid-teens and the later teens. So when we talk about eating disorders in children, it's sort of like we're talking about eating disorders. But eating disorders, it does surprise some people to hear that they can affect children even younger than teens. So children at the age of 12, 10, even sometimes younger, we will see with presenting to eating disorders clinics with eating disorder problems and in need of help. There is some good news about eating disorders in children, which is that if you can recognize it early, there's a relatively good prognosis for recovery or the person sort of turning around the eating problem. And that is often particularly the case if the child and the family can work together with an experienced professional to help the child re-engage in proper feeding and eating behaviors. Children, of course, present special types of problems, especially younger children, in terms of trying to figure out whether an eating problem is going on. So a child is not going to be able to describe their emotional world in the same type of abstract way that an older adolescent or adult is going to be able to talk about their internal world. So there may be more sort of figuring out cues that you see in children, to figure out whether an eating problem is going on. So maybe a child's coming home from school and they're bringing back their lunch and it's not eaten on most days. Maybe that tells you something is going on. Weight loss, of course, if it seems to be progressing. And in particular with children, while there can be weight fluctuations, if you go to the pediatrician and the pediatrician says, oh, your child has fallen off the growth curve, that could be an indication, that something is going on. Clearly, in children, you also always have to rule out, like with adults too, that there's not a medical problem that's contributing to the weight loss that better explains the eating problem. But the good news, again, is that with early intervention in these eating problems in children, there can be a relatively good prognosis. So again, like with all eating problems in children and adults, early intervention and treatment is critical.